Good morning, DAs. So today we're going to get into pharmacology. That would be chapter 15. So if you want to open your book up to chapter 15, let's get into it. So I'm just going to share a little information on my screen as usual. So I'm going to start off with just getting straight into the actual chapter. Okay. So in pharmacology, um, as a dental assistant, I know you're probably thinking like, what do I even have to know about pharmacology when I'm supposed to be just, assisting the dentist and doing procedures? Well, a dental assistant must have knowledge about pharmacology, such as the side effects of drugs, their interaction that could actually take place, um, from more than one drug being used at the same time. Even, a drug that is pretty much used to change, the life process of a body. All right. So, for example, medicines are drugs that are used to treat people. Okay. When a drug causes unintended result, the result may turn into a side effect. So not all medicines that we would actually receive actually will fix the problem. It sometimes have side effects. People have different allergies and side effects to medicine. So with that drug interaction, when it occurs, one drug changes the effect of, you know, another drug by increasing or decreasing the intended result of that actual drug. Now, addictions means that people they may become physical depending on this one particular drug, whether that's pain reliever, sleeping medicine, something to just relax them, they could become addicted to those things. Now, some people, have psychological problems and they pretty much depend on a drug to pretty much help them function correctly. And the meaning of that is some people have strong emotions, and some people just have the strong emotional needs that causes different cravings. So these drugs that we'll get into are called habit forms. Okay, so for example, you as an assistant, you will be responsible for one, filling out a prescription correctly, not signing it, just filling everything out and getting your doctor to sign. So if you're going to fill out a prescription, one, you need to know, what prescriptions, what drugs actually do, if there's side effects, if the patient has addiction to it, if they're forming a habit, the interaction. Can I mix a Tylenol with a aspirin? Can you do those things? We just kind of want to stick to the basics. And as an assistant, of course, we will never diagnose a patient or write a prescription for a patient without the doctor's approval. And, you are able to read the directions that the doctor told you to put on the prescription to help the patient understand how they're going to take the medicine, but you wouldn't just come out and just explain how you would actually take the medicine. So you have to be careful. I always try to just stick to the basics. Um, I pretty much will give the patient the prescription and read exactly what's on the prescription. So they can't say that I told them to do it this way, but the prescription said do it that way. So you just want to be careful in those areas. Okay. Next, let's talk about the names of drugs. Okay, we know we have some medicines that we can get brand names, and some we get in generic names. The difference between the two is drugs are assigned by the manufacturer. Okay, these drugs are pretty much trademark, and some of the generic names can be used also in any business. So, for example, a brand name would be um, a Bear. You know, the Bear aspirins you can buy over the counter. You know, it's a pain reliever, and some people take it for their hearts to keep the, you know, it beating correctly. And then a generic name for Bear would be an aspirin. So it's just all about the name. So if the name is capitalized and it's trademarked, then it would actually be a brand name. So if it's not capitalized and it's unprotected, and most of the time your generic brands of medicine will be inexpensive. So that's how you can tell what's the difference. Now, when you actually fill a prescription and they give you a generic prescription, it will have the brand name, you know, on the side of the generic name, so you can be able to tell the difference. Okay. Now, prescriptions, this is a very important part of our jobs. And I like to get into it because we want to always cover our backs when it comes to legally filling out a prescription. Now, prescriptions can be written by the physician or the dentist or a physician assistant. Now, prescriptions contains information that assures that, one, you want to assure that you're giving the correct drug um, and the correct amount to a patient. That's very important. Now, knowing the parts of what the prescription actually gives you, what name you're gonna put where you're gonna put the patient's date of birth, address, what type of medicine, how many pills you're actually giving the patient, the directions on how to take the medicine, and you know the whole closing of the prescription. So we're gonna get into that a little bit. If you could open up to your chapter textbook, your chapter 15. If you can open up to page 312, we will actually get into the different parts of the prescription and what it actually means. Okay. So um, here on the screen, you'll see my slide. It talks about the heading. The heading of prescription includes the doctor's name, their degree, their address, and his or her office and phone number. Okay. Now, your next part talks about the superscription. That is located directly below the heading, and it'll contain a blank line for the patient's information. So that would be like your patient's name, address, date of birth, things to that nature. Now, the body of the prescription is going to actually have your RX symbol. That symbolizes that it's a legitimate prescription. It's not falsified. That symbol is, you know, in the area where the doctor would actually write the prescription. And that's letting them know that this is where this particular name of this medicine would actually go on this line. Okay. So I'm going to kind of flip out of this for a second, and I'm going to share something else on my screen for you guys. So just hold tight a second. Where is it? Hold on. Okay, so here's what I want to share on my screen with you guys. It's just going to give us a little information right here. Yes. All right. So as I was saying earlier, if you go into your textbook and you turn to page 312, it gets into the different parts of the actual prescription. Okay, so you have about 9 different parts of your prescription that is very important for you to learn. As I said before, you have, and let me just get my pencil. You have here, number one, of course, would be your heading. As you can see in the sample, it gives you the doctor's name of the office, the address, city and state, zip, and then you see this little CK number. That's like the doctor's license, not license, but their pharmacy number, to just symbolizes that this is a dentist. This is they legally have a license to prescribe a patient medicine. Okay, so that registration number, that's what it's actually called. That's what you would you want to verify, and you want to understand what goes there. Okay, then number two gets into your prescription, and it includes the patient's name, address, and the date which the prescription was, written. So here's your patient's name, here's the patient's address, and here's their date of birth. Okay, or if not necessarily date of birth, but the actual date that the prescription was prescribed. Some prescriptions will put the patient's date of birth and some will not. They will just have, today's date or whatever day they got the prescription. Now you do have a certain time frame of how long you can hold a prescription and how long it'll, if it'll expire before you can actually fill the prescription. All right, so here next, of course, you have your RX symbol, and this is right here. It's all that symbolizes um right here it says take through, and that's pretty much what that subscription includes, that symbol, take through. So take through, it means, okay, you're filling it on this day and take it all the way through, complete the medicine, okay? Or it could say that this is, pretty much how long the time frame you have with the medicine. Okay, number four, the inscription, that's pretty much where, like it says, that states the name and the quantity of the ingredients to be included in the medicine. So as you can see in number four here, it says amoxicillin and it says the milligrams. So that the milligrams are determined how many milligrams or how strong each individual pill is. Okay. Number four, the dispense, I'm sorry, five, it just gives directions to the pharmacist to know how to fill a prescription. How many pills do I give this patient? So here, it's dispensing 40 pills that they're going to give. Amoxicillin is an antibiotic. It's to treat infections and things like that. So that's they get 40 pills. All right. Now, when we get into number six, that is a Latin abbreviation. And that Latin abbreviation pretty much gives the patient directions on how to actually take the medicine. So here, number six says 1 capsule quad times 10 days. So quad, if you look at the bottom of page 312 in your book, it tells you that SIG and what the meaning of quad is, and that means 4. So, if I scroll down here, I'm going to show you really quick so it can make sense. Okay, don't worry about this, but here you have, let's find SIG, SIG, and it's a symbolizes to take. So you see it said take, so that gives directions. And then if we go here, it had QID, means quad, and it means four times a day. All right, 4 times a day. So let me erase this really quick. Right? 4 times a day. So that's what we're working with. All right, so let me go back to my prescription. So it says 1 caps, that lets you know that it's a capsule, it's a pill, 4 times a day. So that's for 10 days. So they'll be taking 4 antibiotics in a 24-hour span for 10 days. Okay, and that actually adds up to 40 pills. Okay, so 4 times 10 is 40. All right. So is it a generic brand? So number 7 lets you know if it's a generic brand, and it's saying that um, the dentist signed the blank for number 7. Where it's signed, it indicates it's a genetic prescription, and it's going to allow, or it says, or the medication to be dispensed as written. So it's a generic brand, and it's allowed for the doctor has her name there. All right. I'm sorry, I'm just kind of like trying to read and talk to you guys at the same time, so I'm kind of like all over the place. But it's okay, we're getting it done. All right. So as far as the dispense as written, that pretty much is put in place, and it's put in place to indicate that the dentist, whether or not the dentist, you know, allows the patient to have a refill or not. So if you pay attention to when you pick up your medicine, it'll have on the bottle 1 refill, 2 or 3. And if you look closely here, it actually, let's see, it actually, right here, it actually gives you numbers to circle. So you have 0, 1, 2, or 3, and then it gives you another symbol. So let's click on there, and here it gives you P R N. All right, so let's scroll back down to our list of Latin abbreviations. And here we are, it gives you an actual meaning of what PRN, and it says when necessary or as needed. So that's pretty much indicating that they can take this medicine. Well, the doctor didn't circle a number, but let's say they wanted to give them a refill. Um, they can put, give the patient a refill in a timely manner as needed. Okay. And number 9 is a label. It's the directions to the pharmacist to label the medication, appropriately as is being written. Okay. So if you have any questions as far as the parts of a prescription, if you look on page 312 in your book, it actually starts from 311 to 312, and it does break down the different parts of, what exactly each part of the prescription would be symbolizing. All right. Now let's get into, last but not least, let's get into your Latin abbreviations and the English meanings of the abbreviations. All right. So the first one, it gives you abbreviations. It's AA, and in English that is symbolizing each one. AC is before meals. Some medicines we have to eat with before we take it. Most of the time with an antibiotic, it's pretty strong for your system. And if you don't eat with it, it'll make you, nauseous, want to vomit, feel really bad. So we want to try to coat our stomach with some food before we actually take the medicine. BID, normally when you see B, it symbolizes by. By is twice a day. TID, try, means 3 times a day. And quad, QID, 4 times a day. QH, every 4 hours. Q4H, every hour. And then Q4 would means every 4 hours. Q8, you would take that medicine every 8 hours. And of course, we know SIG would be take, and PCP, you would take that after meals. So one medicine you'll take before you eat, which is the AC, and the PC would be after meals. Okay. PRN, as we discovered earlier, when necessary or as needed. Okay. Now, your closing of your prescription, we already talked about that a little bit, but I just want to remind you that the closing, if you look right here, the closing of the medicine or prescription is where the dentist would sign his or her name. That would be the signature. And that's to one, let the pharmacist know, like, hey, I'm writing this prescription. I am a legal doctor. I am allowing refills, and I want you to make sure you give this to this patient and write the directions out carefully so they can know how many times to take it and where there's a generic brand. And that's pretty much one of the major parts of a prescription that you would need to know. So let me, I'm gonna click back to my regular screen. Okay, so just to kind of let you know how it actually works um, with prescriptions, that's what we're gonna cover in this section. I will be leaving some questions on Edmodo with this lecture, and I'm hoping that um, this kind of gives you a better understanding, and we will work on this in lab. You will get to actually fill out the prescription, but it's good to know what prescriptions, um, the parts, what it means, why we actually have to write a prescription, how to protect ourselves, and how to help the doctor stay on track. That's what our job is for. Okay. So, like I said, if you have any more questions, please get with me and we will go forward. Until next time.